I as a way to be aware of your own emotions so that you can process those, use them productively, or let them go. And that's exactly what we want you to do with your patients as well. It really does affect the environment positively or negatively.
What if emotional intelligence is the most important clinical skill nurses never learned in school, yet it's shaping every patient interaction and every tough conversation? We've all heard the phrase, nurses eat their young. But what if emotional intelligence is the power tool that finally shuts that narrative down? Today, we're uncovering the fuel that keeps teams connected, grounded, and performing at their best. Welcome to Lippincott Spark, Illuminating Nursing Education, the podcast that fuels teaching, innovation, and leadership. I'm Dr. Kelly Drees. Each episode, we spotlight bold ideas, expert voices, and practical strategies to help you teach smarter, lead stronger, and stay inspired. Let's spark new thinking and dive into today's episode. Emotional intelligence may be the most overlooked clinical skill in nursing, and one of the most powerful. It shapes trust at the bedside, strengthens teamwork, and supports nurse well-being in an increasingly complex healthcare environment. The research is clear. When nurses develop emotional intelligence, they communicate more effectively, navigate conflict with confidence, and collaborate more easily and build resilience against burnout. That's the focus of our conversation today, and the timing couldn't be more important. I'm thrilled to welcome Dr. Pamela Stokes, a nationally recognized nurse leader and educator with more than 2 decades of experience across clinical, academic, and executive roles. She's widely known for her accreditation expertise and her compelling insights into the evolving role of today's professional nurse. Pamela, welcome to the show.
Thank you so much for having me. I'm excited to be here.
I'd love to have you start us off with what is emotional intelligence? You know, when you look at these components through that nursing lens, what do they actually look like in practice, and how do you see them showing up in real clinical or even academic environments?
Yeah, so emotional intelligence in nursing, it is not just an abstract concept. It is showing up constantly in everyday clinical and academic practice. So when you translate the core components of EI or emotional intelligence into the nursing context, they become very practical behaviors that really should be more of a competency-based skill is what we're seeing. So we talk about a few components. There are things like self-awareness, self-regulation, motivation, empathy, and social skills. Those are the big ones, right? If we briefly go through each one of those, it really is just the definition of what we understand a nurse to be. So there's a reason why nurses are voted like one of the most trusted professions every single year, right? It's because we expect that person at the bedside to really know what they're doing and be caring and empathetic, and be able to talk to us and our team. Right? So I'm going to go real quickly through each one of those just so we can kind of understand what that means. Yeah. So if we start with self-awareness, we may take that for granted, but it's really your own emotions. It's being able to recognize stress levels. It's being able to recognize your own biases and your own reactions to things. So when we're caring for our patients, it could be that you're feeling frustrated during a busy shift. You've got a really high patient load or a patient with high acuity. And then all of a sudden you're feeling overwhelmed. And so how do you process those feelings? Do you recognize them? Can you control them or use them in a productive way? And that kind of feeds into our next concept, which is self-regulation. So when you're self-regulating your own emotions, you're making sure that your actions and behaviors are not affecting patient care, teamwork, decision-making, things like that. So we could take that same frustrated, stressed nurse and look at how they stay composed during a code, or look at a student who's overwhelmed by maybe critical feedback that they receive during a post-conference, but they take that and do something productive rather than melting down and not being able to process their emotions. So self-regulation and self-awareness really kind of tie together. Then we move on to motivation. So nurses should be, and usually are lifelong learners. So, motivation is looking at this internal drive to provide high quality care. It improves professionalism. You remain committed no matter how overwhelmed or what challenges you face. You're still motivated to provide empathetic, compassionate care to your patients. And as a student, you're motivated to learn the information so that you do a good job, not just to pass a test. Finally, we move on to empathy and social skills. So these are the ones that everybody expects. So empathy, meaning the ability to understand and share feelings and experiences of your family members, but also, let's not forget, your coworkers and interdisciplinary team members. And then social skills, communicating that compassion effectively in order to collaborate and build relationships. So, this is what we think the perfect nurse is, someone who's caring and compassionate. And in years past, we sometimes forgot about the level of clinical skill that they brought, but we always expected them to be caring, right? To make us feel better. That's what nurses do. So, when you tie all of these together, it's exactly what you said. In a stressful, rapid decision-making environment, we provide this level of emotional intelligence that gives better patient outcomes. It improves communication within the interdisciplinary team. It reduces burnout, and we can talk a little bit about that later. But ultimately, it just provides a stronger leadership environment.
When we talk about emotional intelligence, also called EI or EQ, which is the emotional quotient, we're really talking about how we navigate emotions, our own and others, and especially high stakes moments. And I think about in nursing, which is both technically complex and emotionally intense, EI may be one of the most under-recognized clinical competencies. So, Pamela, hearing what EI looks like in action really sets the stage nicely, but it also opens up the door to a bigger question in my mind about its impact. So, why do you think emotional intelligence is so essential in nursing right now? You talked about teamwork and burnout and whatnot, but how does it actually shape trust with like patients and influence that culture of our teams and even support emotional well-being of, our nurses themselves?
Yeah, absolutely. And, sometimes nurses are their own toughest critic. Sometimes nurses are their own worst enemy, and we're sometimes bad patients. I hate to say all of those things, but that's just the truth of the matter. And so when we talk about emotional intelligence, it's not just for the interdisciplinary team and for the patients and the families, but it's also for ourselves and our own well-being, just as you mentioned. And so it's really important that you recognize, and I think we all do, that healthcare is complex, it's fast-paced, and it's emotionally draining, right? It's emotionally demanding on a daily basis. And so EI is a way to be aware of your own emotions so that you can process those, use them productively, or let them go. And that's exactly what we want you to do with your patients as well. It really does affect the environment positively or negatively. I'll use myself as an example. So I had some run-ins with faculty and other nurses who were just not very nice. And I was so stressed out and unaware of my own self-regulation and how to process those emotions. And I had no support to do so. It was really detrimental to my own nursing practice and to the patients around me because I was scared to ask questions. I was scared to move forward and say, hey, I made a mistake, or could you help me? I really know nothing about what I'm about to do. And when I look back on that as a seasoned nurse, I realized that there could have been some really poor patient outcomes because I was unwilling to go forward and ask questions to someone who maybe was unkind. And so when we talk about emotional intelligence, yes, it's fast paced. Yes, we're barking orders. We're trying to prevent something bad from happening, or we're trying to save a life. So it's very important that we're direct, but there's a difference in like an uncivil interaction and one that's emotionally intelligent. And so nurses with empathy and self-awareness, they recognize fears in their patients. They recognize concerns or confusion with patients and families. They communicate in ways that make patients feel heard and respected. They're more likely to share important health information when they feel emotionally supported. And that's true not only for patients, but for colleagues and coworkers, especially if you're a mentor or a seasoned nurse who's helping someone who's maybe more novice. So it shapes unit culture, it strengthens teamwork and interprofessional collaboration. The list could go on and on.
Absolutely. And I think about emotional intelligence in nursing isn't about just being nice, right? It's about making better decisions under pressure, pausing. And I'd like to say, kind of get your head on straight and just try to protect yourself from that burnout. And I think the best part of it is here it is, wait for it. The best part of emotional intelligence is it's teachable. I believe it is teachable.
Absolutely. Yes.
So, and once we recognize how powerful it is, I guess the next natural question is how do we help students grow it? You work with nurse educators very closely. So, from your perspective, what are the most effective ways faculty can help students truly develop their EI?
That is such a great question. And I hope that we all take a step back and realize that it's not just about teaching clinical skill. We can teach this. You're so right. Developing emotional intelligence with nursing students, it requires intentional experiences, right? Reflection, modeling. It allows that student to practice emotional awareness and interpersonal skills in real time contextual situations. So, for example, we tell students, it's going to be kind of scary the first time you do an IV, but we never sit down and practice an interview with someone who's experienced death in their family or they've received a diagnosis that is terminal. They're going through something that maybe they don't understand. We do practice it to a point, but we don't confront the students with, it's okay to mess up. How could you say this differently? Right. And when I go back to my experience that I was just telling you about, when I had a faculty member that scared me to death and wasn't very kind, she wasn't modeling the behavior that I would want to see in my personal nurse if I was in the hospital or I had a family member in the hospital. So, some things that we can do is reinforcing and teaching self-awareness and self-regulation. So reflective journals with clinical assignments and clinical experiences, guided reflection with questions that follow challenging patient encounters. And that's why I love simulation so much. That is one thing that simulation has done for us, is allowed us to push pause when in real life we cannot. Please, for educators out there, don't take for granted post-simulation debriefing and post-conferences. I've seen those sometimes go along the wayside. They kind of have been taken for granted. It's so important that the students feel like they can sit in a post-conference and be like, that was an awful day. Please let me talk about my feelings. Sometimes biases come up, and we all have them, that they weren't aware were there, and they need a safe space to talk about those so that they won't maybe say something inappropriately in the clinical environment. So,
Yeah, you're keeping it real,
post-conference,
right? Keeping
yes,
it real.
yes, they need a safe place.
Yep.
And
Yep.
they don't want to feel judged by the staff there, but they don't want to make the patient or the family feel uncomfortable. So they need a place to say it, right? Most importantly, faculty modeling on emotional intelligence is so important as well. So, respectful communication, calm responses in stressful moments, empathy towards students is going to provide the students with an example of empathy towards patients, and an openness to feedback. So, we're all busy, we're all stressed. It's really important that I almost use that therapeutic tone, that therapeutic communication with my students like I do a patient, because they're more stressed than I am. They don't want to hear about how many papers I have to grade or how difficult it is for me to make it to clinical. They're just as stressed as me. So I think modeling is really important,
Yeah, you're
but it's
bringing that
okay.
calm to chaos,
Yeah,
right?
yeah.
Yep. Yep.
Yeah, so letting them know that I'm going to take a breath and I'm going to talk to you like I would my patient. And I did that intentionally. It's okay for this to be a competency. It's okay to teach this. It's something that I think is taken for granted. There was a study done, and I can't quote who it is, so don't ask me to. But it was years ago. I'm showing my age. It was like in the 80s or 90s, with medical students and bedside manner. and how it was terrible when they got into their residencies. And they're like, well, there's no surprise. We've been working on cadavers and skeletons for how long? And now we have to interact with real people. And I always refer back to that because I think it just speaks to how special nursing is. And so we have to keep that empathy and that emotional intelligence at the forefront of our practice.
And I love how we can learn to increase our EI, like you said, through the awareness, through the regulation, through the empathy and that skillful interaction. And most importantly, that reflection. You mentioned pre-briefing, debriefing, those simulated experiences, those reflective journals, the modeling, but also that cognitive rehearsal and practicing and even peer reflection groups. I think, getting
Oh, for
feedback
sure.
from people in those real world moments, that's when you're going to be learning and will lead to meaningful growth, I think, over time as well. So,
Yeah, and then it also tells the student that you're in a psychologically safe learning environment, right? It's okay to talk about that. And my students laugh at me because I'm like, we're going to go to the fluff today. We're going to talk about fluff because they all are so ready to start an IV, but they're not ready to talk about their feelings. And the truth of the matter is, I could teach anybody how to do an IV, but it's a very unique skill what we possess as nurses in learning how to communicate effectively with the team and the patients. So yeah, creating that safe learning environment is huge.
yeah. And that intentional curriculum design, too. I think you can weave it into the curriculum so that it is very apparent in each course. Okay, now, this is how we're going to build that skill set, that competency. So I'd love to share a very, very simple 1 minute daily kind of emotional intelligent reflection that I use. And maybe you use
Okay,
something
yeah.
similar that I use at the end of the day or in between meetings. It's really designed, I think, to be very quick and focused and repeatable. So, what I kind of do is do this 1 minute reflection. I take a very deep, kind of slow breath. And then I ask myself like 5 different questions. The first one is, what am I feeling right now? What am I feeling right now? Kind of name that emotion as specifically as possible. Just not, oh, I'm feeling good, I'm feeling bad. No, what is that?
Exactly.
Is it calm? Is it frustration? Is it, I feel energized? I feel disappointed? And then the second question, what triggered this feeling today? Identify that one moment, that interaction, or the thought that really stood out, right? The third
Yes.
thing I ask myself is, how did this emotion show up in my behavior? So this happened. This is how I'm feeling. I've identified the moment that it happened. So, how does it show up in my behavior? How am I reacting to it in my words, in my tone, in my body language? You
Love that.
know,
That's intentional self-regulation.
yeah,
Yes.
yeah. To be aware and in my decisions, how has that affected my decisions? So, what did it influence? The fourth one that I question that I ask myself too is, what might someone else in that situation have been feeling or needing? So when this
Nice.
happened and I felt this way, what did they need? You pause to kind of consider the other person's perspective without judging it.
For sure. Yeah, the biases are part of it. You've got to acknowledge and dismiss. Yes.
And then that last one, fifth one that I always ask is, what's one small thing I'll try tomorrow? Okay, what can I learn from this experience? Kind of a different response, or maybe a different question, or pause, or, get my head around something, a different mindset. And then I finish with, after I kind of quickly go through those 5 quick questions, again, at the end of the day or between meetings to kind of get my head on straight, I say, okay, that's enough for today. I close out
I
my
love it.
day and
You
say,
set your
great
own
job,
boundary, right? But it provides motivation for the next day as
Yeah,
well. So yeah, you walked through that beautifully. That's so
yeah,
nice.
yeah,
I actually do something similar. I love how you broke down the questions though. I'm going to steal that.
yeah,
But
absolutely.
I actually talk with my students about square breathing, which is very much what you're talking about. So I provide them with a quick walkthrough. We do square breathing, which is just imagining a square and you taking a deep breath in and out and in and out again. It really resets your nervous system to process feelings that are overtaking maybe a critical thinking mindset, but you're reacting emotionally. And then you do exactly what you said. You acknowledge what you're feeling, what the behavior was. But I like the way you broke down the questions because the difference in how you did it is it provides you motivation for the next day to change the behavior. There's a follow through. That's
Yeah.
great.
Yeah.
Yeah.
And then to end, like, that's enough for today. Great job. To give yourself some grace, because not everything is going to go perfect, right? We have to learn
Yes.
from this and build on this and grow. So, and I think, of course, emotional intelligence doesn't just support learning. It pushes us to rethink some kind of long-standing narratives in nursing. And I'm going to give you one. So I'd love your reaction.
Yes.
So
I know what's coming, I
here
think.
we go. Here we go. We've all heard the phrase nurses eating their young. Okay.
Yes.
Nurses eat their young. So,
Yes.
how does emotional intelligence help challenge or even hopefully dismantle that narrative? And what do you believe educators or leaders should be intentionally focusing on instead to build a healthier culture?
Yes. So, a little background on me. My very first research project was based on this very phrase and the faculty member that I keep referring to.
Oh,
So, the
wow.
phrase
Okay.
nurses eat their young bothered me so much. It reflects a long standing cultural problem in healthcare. It really does. It's one where nurses and students they experience criticism, exclusion, harsh treatment from one or more of experienced staff or faculty, right? And we say it jokingly, which is what bothered me so much because when I entered nursing, it was really the height of recognizing that nursing was stressful and that there was this hierarchy of I have experience, so you pay your dues. Burnout was at its peak. We were starting to see these giant sign on bonuses. That's when I entered nursing. So, this was one of my research projects. So, basically, my argument for this is that emotional intelligence helps to break the cycles of incivility. It helps to prevent that. And it takes a huge culture shift, which I think we're seeing, especially in these large organizations who are prioritizing EI and EQ. But many negative workplace behaviors are not necessarily intentional. They're coming from stress, emotional fatigue, and poor regulation. So if we're not good patients ourselves, and if we're not taking care of ourselves, or we feel not appreciated or not needed or burnt out, we may not recognize our own emotional triggers. And so we don't regulate frustration and stress well ourselves. We don't take care of ourselves. So we need to communicate frequently for constructive criticism and feedback rather than being critical. I experienced one time on a shift with an experienced nurse. She thought she was teaching me by giving me a really heavy patient load. So she gave me double the amount of patients that anybody else had, and I was brand new. I didn't know how to deal with it. And again, I was scared. I'd been taught this nurses eat their young culture, right? And so I didn't speak up. Now I would, but it takes the experience of being aware of your own emotional intelligence, and I wasn't. So I think that it's important that we teach staff just like students. We need to teach an empathy for learners, respectful communication, an openness to questions and feedback. That needs to be a part of like a campaign, whether it be the unit or the organization, right? Because emotional intelligence encourages mentorship, not hierarchy. That's the difference. So we need supportive coaching, collaborative learning, instead of this hierarchy of you have to make it to this point before you can take a breath, right? And so I do see that faculty and leaders are going to lead towards changing that culture because, like you mentioned at the very beginning, it's intentional leadership and educational practices. It's not just, I'm just going to model this behavior and see how things go. We're seeing facilities that have such high levels of burnout that this is becoming an intentional campaign in their ongoing continuing education, and it should be. So, we can pair experienced nurses with students and new graduates. We can create safe spaces and debriefing and reflection meetings just to talk about our feelings. There's lots of nurse residency programs that are doing this with new nurses. We can normalize learning curves, especially during transition to practice. So that's what these residencies are doing. And it's really a system problem itself. So if the behaviors are stemming from like system pressures, like we can't change the heavy workloads or the staffing shortages, emotional fatigue is going to happen. So a lot of it starts with not only nurse leaders, but with human resources and faculty talking about what the normal should be and what it should look like and expecting nothing less.
Those are great strategies. Thank you. Speaking of culture, you mentioned leadership. We know that emotionally intelligent leaders can really set the tone, right? Good or bad. How can nurse leaders model emotional intelligence in ways that genuinely reflect psychological safety and building that team cohesion and workplace morale? What actions or behaviors? You mentioned a couple, but is there anything else that you want to say about kind of that leadership piece that may make a difference?
The very first time I became a nurse leader, I was a little nervous, because you flip from being a staff member and sometimes a disgruntled staff member who feel like administration doesn't get it to the quote unquote bad guys. And I didn't want to be a part of that culture. So I think the first thing that I did was let them know that I'm on their side. And sometimes actions speak louder than words. So on busy days, I made it a point to set aside some time for myself to work in the trenches with the staff because I never wanted to become the nurse administrator who was unaware of what was happening and forgot how to do things and forgot where I came from. And so one of the things I think that helped me bond with them the most is that I jumped in the trenches and not just modeled emotional intelligence, but I was there for them. Even if I was like, hey, I'm not good at this procedure, I haven't done it in years, but can I be a runner for you? I think that setting aside intentional time to work alongside my staff, it's like being a part of a really stressful team. You bond, you form this camaraderie, right? So that was one of the first things I did. I made sure that at the top of my list, whether it be in meetings or huddles or conversations, that I prioritize nurse well-being. So some sort of topic or statement that let me know that I was looking at nurse well-being, whether it be a campaign, a piece of education, or a question to them about how they're doing. I made workload balance a priority. I made sure that there was access to mental health and that we didn't dismiss that. So it could be providing them with resources from human resources, or if you're faculty on campus with mental health resources, but also checking in frequently. And I did frequent check-ins, not just annual performance evaluations, but little brief meetings or lunches or snacks or coffees or, hey, just a walk down the hallway to check in with my staff. And then I provided opportunities for peer support because I can't be everywhere. So we had certain strategies, like we had a compliment your coworker box where we just drop in little compliments. We had identified mentors who were really good at talking therapeutically through feelings, because it's not all about one person, whether it be the faculty member, the administrator, the supervisor. It's about the team as a whole. So you really have to live that.
I love that frequent check-ins. It's like those, instead of exit interviews, how about some stay interviews? Just conducting those and not just at the end when somebody makes their graceful exit. So paying attention to those nonverbals. And I think having that great situational awareness of what's going on with your employees or your faculty. So to make it even more concrete with our listeners, are there any other real examples, and you gave a few already, which was great, that kind of fundamentally changed a patient interaction or team dynamic or even in organizational outcomes? What happened or what shifted because of it?
One of the situations that comes to mind is probably, I don't want to downplay it, but I say it's one of the smaller encounters that I had, but I was so proud of it. I was probably a very novice nurse, maybe a couple years out, but I do feel like because I was so passionate about incivility and this whole nurses eat your young thing, I think I was uber sensitive to being empathetic. And so we had a patient that was really, really sick with pelvic inflammatory disease that several nurses throughout several shifts had been talking to and trying to educate, because there was this repetitive cycle of behaviors that was contributing to her health. And she was about to sign out against medical advice. And I could see the frustration on all of the nurses and providers' faces when I came on shift. They were just done with her. Like, get her out of here was the attitude. And it really bothered me. Although I hadn't met her, I didn't know how challenging she could be. But I went into the room and I told myself, I'm like, I'm going to do my best to be different. And how can I be different? And aware that, yes, she's doing repetitive, harmful behaviors to herself, but we can provide her with some education that hopefully changes her life as well. And so when I went into the room, I told myself I was going to sit down on her level, just like I learned in nursing school, with my hands and arms uncrossed, and I was just going to listen. And I think I listened for probably about 30 minutes before she said everything she wanted to say. And then when she was done, she's like, well, that's it. That's all I have to say. You're the first person that's heard me
Oh,
out.
sure.
And by the end of that interaction, I had her so excited to stay in the hospital. Like, I did little things like warm blankets and snacks, and I spent the time to talk with her. She didn't sign out AMA. We talked a lot about behaviors, and all she wanted was for someone to listen to her.
Yes. Yeah.
So I know that's not a big organizational change, but in my personal practice, when I came out, I remember several of the nurses saying, well, you're a miracle worker. You get the difficult patient from now on. And I thought to myself, but I'm not. We're all human. And I say that not to toot my own horn, but just to say that it stuck with me from then on, that no matter how old you are, no matter what you've been through, no matter how much experience you have, like, we're all human and we all just want to be heard.
It made a difference to that patient. That's fantastic. Well done.
Thanks.
So, Pamela, we end every episode with a final spark, a piece of wisdom or an encouragement for nurse educators and clinicians. What spark would you like to leave with our listeners today?
So I really want listeners to know emotional intelligence is the hidden clinical skill in nursing. Research shows it can matter just as much as technical expertise when it comes to patient trust, teamwork, and even reducing burnout. And so I'm going to leave you with my favorite quote. It's Maya Angelou, and it's, people will forget what you did or what you said, but they're never going to forget how you make them feel.
Awesome. Thank you so much. This was such a powerful conversation. And we know now emotional intelligence isn't optional. It's definitely the foundational to the future of nursing. Thanks again, Pamela.
Thank you.
Thanks for listening to Lippincott Spark. Be sure to subscribe, share with a colleague, and leave us a 5-star review. You'll find links below to learn more about Lippincott nursing products and services. Until next time, keep learning, keep leading, and keep sparking innovation in nursing education.